Think about this. This is a 10-year program they have. Year 1 and 2, they collect the revenue from the tax increases, and they cut Medicare. Years 1 and 2, but they don't have a program. They start the program in year 3. They begin to sign people up and don't expect until year 4 or 5 or 6 that they'll get fully up to speed. And yet the surplus that they create by having tax increases and benefit cuts in year 1 and 2, that little surplus, gets eaten away so that by year 4 or 5 or no later than 6, they've run through the deficit and they begin to have annual deficits. They've run through the surplus and they begin to have annual deficits every single year. And that's his Congressional Budget Office saying it. And he somehow believes that we're so stupid that we're not going to pay attention to this and somehow swallow it. Oh yeah, you can keep the plan that you have. If you like what you got, you get to keep it. You'll notice he changed the language on it and said, well, we're not going to require you to give it up. But if you make it so expensive for health care, it's going to cause people to drop coverage for their employees and pay the 8% fine. And those of you who own a business, you go back and ask your HR person, are you paying for health coverage for your employees a figure equivalent to or greater than 8% of your payroll costs? And I think you'll find, as I did when I examined my small business, that I'm paying more than 8% of my equivalent payroll costs. So small businesses are going to look there and say, you know what, I pay a fine of 8%, or I keep paying more than that and cover my employees. And instead they're going to take it makes economic sense. Dump them. Make them go on the government plan. 2 respected studies done by the Little Group indicate that on the House bill, it could be 120 million Americans lose their private insurance coverage, and in the Senate bill, it could be as many as 80 million people lose their coverage. And if you cut Medicare Advantage, 1 out of every 4 seniors has Medicare Advantage. If you cut about $177 billion worth of funding over the next 10 years, guess what? Every one of those programs is going to have to cut benefits or go out of business. So you aren't going to be able to keep what you want, and yet he repeats it all the time. Oh, I won't, he said in the State of the Union address, he said it was misleading that he was going to cut Medicare and Medicaid. Well, his own plan says it. He's going to cut it $622 billion. On Sunday, he said, well, it's waste and fraud, implying that it was easy to get. Well, if it is, I've got a suggestion for him. It's in my column tomorrow in the Wall Street Journal. Why doesn't he just lay out a bill with all those simple, easy-to-make Medicare and Medicaid cuts and have it run as a standalone bill? Get it past Congress. No, it built people's confidence that he could actually get it done. And guess what? He's no more going to do that than the man in the moon. And why? Because he can't do it, he won't do it, and he doesn't want to put Democrats on record as being for it. He's hoping that he can hide it in a gigantic bill. Oh, we're not going to have rationing, he says. No, there's not going to be rationing. Sure, there's going to be rationing. Every system of government-run healthcare in which you have to set a price and control the total amount of spending ends up rationing. We're already seeing it in Medicare and Medicaid. Doctors, 53% of doctors this year say that they will not take any more Medicaid patients. And you know why? Because the government pays you less under Medicare and Medicaid than the actual cost of services. If you are a doctor, you get paid on average under Medicare 81 cents of what you get paid by a private provider. If you're a hospital, you get paid 71 cents for every dollar you get paid by a private provider. The American Association of Pediatric Hospitals says that every child that is brought to it on a government-funded program, because the government sets the prices, that they recover 30 cents of every dollar they have to put out for care for that child. The estimated cost of the so-called cost shifting is $88 billion a year. The other care has to be paid for somewhere, and what they do is they shift the cost to those of us who are not Medicare, Medicaid, or S-chip. And what it means is it means rationing. And of course, I love how he sort of paints it as we're all going to be able to keep the relationship we have with our doctor. When you have the federal government setting standards for care, when you have the federal government setting rules for care, when you have the federal government describing how much people are going to get paid and what they can get paid for, if you regulate and prescribe prescribe and direct health care from Washington, D.C., guess what? There's going to be a federal bureaucrat between you and your health care provider, no ifs, ands, or buts. Does he think we're stupid and don't understand that? Now, you know what? This is what gets me. It's not the #1 issue facing America. That's our economy. And second of all, there is no gigantic demand for the kind of radical changes that he's proposing. 9 out of every 10 Americans have health care coverage, and 84% of them like it. They're comfortable with what they've got. We keep hearing this number tossed around about 46 million uninsured. Well, guess what? The Census Bureau says 9.7 million of them are not U.S. citizens. I don't think we ought to be upsetting America's health care system to cover 9.7 million people who are not here. 17 million of them, according to the Census Bureau, make $50,000 more a year. They made a conscious decision not to insure. I wish they did. It's in their family's best interest to insure. They can afford to it. But why are we trying to upset the system for everybody else? Because 17 million people out of 307 million people say, I can afford it, but I ain't paying for it. And we got 14 million of them, 14 million of them, who are eligible today for S-chip or Medicaid. That is to say, they're already covered by existing government programs. Government hasn't done a good job of signing them up. So let's mess up the health care for everybody else in America because the government can't get the job done of signing them up. That leaves 5 million people who are working poor, who are not covered by Medicaid or S-chip and can't afford health insurance. 5 million out of 307 million people in this country. Shouldn't we be worried about the answer to solve that 5 million people's problem instead of upsetting the apple cart for everybody else? This does show the challenge that we have as conservatives. We'll be defined this year by what we oppose, and we're opposing Obamacare. But by next year, we need to be able to articulate what it is we're for. Because there is a problem. Some people are not getting health insurance. They can't afford it. Some people are not getting health insurance even though they can afford it. They can afford it. And what should we be doing as a society to help make health insurance coverage more accessible, more available, more affordable, and to do what we can to begin to bend the growth in healthcare expenditures to more closely match inflation? The good news is the conservatives have a lot of good ideas. The bad news is we're not comfortable talking about them. Oh, you get us talking about, I don't know, taxes, national defense, values. Well, we can get out there and talk, we can talk up a storm. But when it comes to talking about some of these kitchen table issues, conservatives show a reluctance to get into the fight. But think about it. It's conservatives who say, you know what? If we want to encourage people to get health insurance, let's give a tax deduction to the wealthier people, the middle class people. Let's give a tax credit to the low income people to incentivize them to go out and get health insurance. It actually gives for younger workers just starting out money in their pocket if they have health insurance. And so we get them in a healthier place. And it costs a fraction of what we're talking about. In fact, the way to pay for it is to say, we'll treat health insurance like we do your mortgage. If you have a mortgage of $1 million or more, you get your interest deduction phased out. Well, the average cost of a health insurance policy in America today is about $5,000 for an individual and about $12,300 for a family of 4. If you get up there at $21,000 or $22,000 or $23,000 for your health insurance policy and you begin to phase out deductibility, guess what? The tax savings from that more than pay for a tax credit and tax deduction. And you know what it does? It makes health insurance truly portable. You're not stuck in a job because you're afraid to lose your benefits. You own it. You're on an equal footing with the tax break we give to corporations. You get to take your health insurance with you from job to job. 40% of Americans say they feel stuck in a job they don't want to have because they're afraid of losing their benefits. That takes away that worry. You know, we're the people who say, as conservatives, you ought to be able to save tax-free for your out-of-pocket medical expenses. Health savings accounts. I got one, I love it. I'm about ready to talk to Ed and say, hey, raise my deductible and lower my premium because I've saved enough money in my health savings account to cover that higher deductible.